How you doing, guys? Dr. Nathan Thompson here with Exemplify Health Center, a wellness way. Let me get that in here. I'm backwards. A wellness way affiliate. Happy Tuesday night. I'm just finishing up at the office and wanted to jump on and share some very important and unique ideas with you just to help you start to think differently about a lot of things. So today, if you saw the initial screen, and I'm going to show it to you in just a second. I'm going to talk to you about what all of those different things that you saw in that picture, what they all have in common. And one of the reasons why I came up with this idea is I was talking to a patient actually not that long ago, earlier today, and she had said, Dr. Nate, I wish you could really help my daughter. She has all of these autoimmune type conditions that are going on, and doctors don't know what to do. You know, she's taking all of these different corticosteroids in order to lower inflammation inside the body, massive hormone issues, type 1 diabetes, and she just says it's on and on. And in fact, it's gotten so bad, it's actually affecting her sight. So I want to talk to you about a unique perspective, especially when it comes to autoimmunity, because when you look at all of the different types of autoimmunity, it's absolutely mind-boggling, you know, all of these different ones. But there's one thing, one connection between autoimmunity and all of those autoimmune conditions. It all runs parallel to one another, because when you look at the symptoms of autoimmunity, a lot of them are actually going to be the same. So if you guys are watching right now, give me a thumbs up. Just go ahead and comment where you're watching from. We always like to see where people watch. If you're watching the replay, go ahead and type replay for me. So I'm going to talk about a very, very unique perspective when it comes to autoimmunity and some things that you can do in order to start helping any kind of autoimmune type reaction inside the body. And how to know if you have it, I'm going to go over some of the symptoms because all of them are pretty much the same. So let's talk about autoimmunity and give you a different perspective, a unique perspective. But one of the reasons why I want to talk about this is we're going to be coming up in 2020. We're going to be doing a very special talk about autoimmunity. And the reason why is because, unfortunately, we have to. Because autoimmunity right now is one of the leading causes of illness and death in women 20 to 40. And the amount of people who are suffering with autoimmune conditions is absolutely astounding. So I'm going to show you that first picture that I started at the beginning. And I want to actually show you this. All right. So let me see if I can make this just a little bit bigger. So when you look at this picture, and in fact, if you know right now what this picture is in the top of the middle, if you know, in fact, what that is, I want you to go ahead and put what you think that is a picture of, because the answer will probably surprise you quite a bit. But I want to talk about what a sliver, what an ingrown toenail, what tattoos, what dental implants, and what joint implants or joint replacements all have in common. And also that big word in the middle, food allergies. So what all of these things have in common, and if you know what all these different things have in common, I want you to go ahead and put your answer. So whether you're watching a live or whether you're watching a replay, go ahead and put your answer of what you think what all of these different things have in common are. Now, here is the answer to your question, what on earth is this at the top? That right there is a 3-year-old breast implant. So it's a 3-year-old breast implant. So what does an old breast implant, tattoos, dental implant, joint replacement, ingrown toenail, and a sliver, and food allergies, what do they all have in common? They all cause inflammation, and they all activate a certain part of the immune system. And I'm going to show you how these things, a breast implant, a tattoo, a joint implant, or a dental implant, how the body treats it no different than as if it was a sliver or if it was an ingrown toenail. So let's talk about this. Now, the first thing I want you to know is if you guys have ever gotten a sliver, or if you've been unfortunate enough, like I have, to have an ingrown toenail, here's what happens. What happens Hopefully you can hear me again. If you can hear me, give me a thumbs up. So our camera kicked us off of this. So as I was saying, so if you get a sliver or if you get an ingrown toenail, just think of this. An ingrown toenail or a sliver is called a foreign body, meaning that sliver or that ingrown toenail doesn't belong underneath the surface of the skin. So anytime that you get a sliver, anytime you get an ingrown toenail, what happens is you're going to have an immune system response to it. So the immune system looks at that sliver, looks at that ingrown toenail, and says, you know what? You don't belong underneath the surface of the skin. We're going to start having an inflammatory response to it to either try to break down that, or if we can't break it down, we're going to start to wall off that area to protect the rest of the body from it. And I'm going to show why that has everything to do with things like food allergies, why that has everything to do with breast implants, tattoos, joint replacements, and even dental implants, and how that can actually lead to some form of autoimmunity. But the first thing I want to show you is help you to understand how the immune system actually is supposed to work. So if you look at the immune system, you have two different parts of your immune system. And I'm actually going to talk about this in a lot more detail within our Exemplify Healthy Families Facebook group on Saturday. And we're actually going to talk about the immune system and kids. So if you have kids, you have grandkids, and you want to learn about how to raise a child to have a titanium immune system, make sure that you search out the group Exemplify Healthy Families. Ask to join because that talk is going to be exclusively within that group. But if you understand the different types of the immune system, you're going to understand how to have the immune system work with you. So when you look at the immune system, one of the things that is always there to help you, protect you from foreign invaders, to help protect you all the time from food poisoning, from infections and things like that, is you have what's known as barriers. So your skin is a barrier, your mucous membranes in your eyes, in your mouth, in your intestines is considered a barrier to help you. Specific digestive enzymes within, the pancreas, the small intestine, the stomach pH, and then even normal bacteria that live in your intestines are all going to be considered barriers that protect you from infections. But here's the thing. You also have another part of your immune system, which is always on, and it produces an immediate response anytime something goes through these barriers, makes it past the barriers, makes it past the skin, makes it past the mucous membranes of your intestines, and you have these white blood cells that are always there, they're always on, and they're always active, and they're always there to protect you from an attack. They're called neutrophils. They're called macrophages, natural killer cells. And what those do is those are really, really non-specific type of cells. And when you have these non-specific type of cells, then they're always there to break down things that aren't supposed to be there. In fact, this is one of the first things that happens when you get an ingrown toenail or when you get some kind of sliver, is that you have this inflammatory response that takes place. Now, going back to other things that forces this reaction to take place is when you bypass those barriers and you start to put things inside of the body like a sliver or an ingrown toenail that don't belong there. So things like breast implants, things like joint replacements, things like food allergies are another thing that forces the body to have an immune system response, and then also any kind of dental implants. So what they do is they're forcing the immune system to react to it, to cause an inflammatory reaction to try to get rid of that large invader. And that immune system will always be at work, and it will always cause an immune system reaction until the insult has been either removed, or if it's actually been walled off to protect it from the rest of the body. So this is what's interesting, is if you look at the amount of autoimmunity today in people, it is absolutely incredible. It begs the question, what are we doing to our immune systems? So one of the biggest things is, and how when we start working with anyone with autoimmunity, is what can we do to lessen all of the different immune system responses that are taking place inside the body? So this is why one of the first things that we do with anybody with any kind of autoimmune type reaction that's taking place, this is why one of the first things that we can do in order to control that inflammatory response and take the burden off the immune system is, in fact, doing food allergy testing. But I want to show you some research that's really interesting when it comes to like looking at like inflammatory reactions or autoimmune type reactions anytime that you put a foreign body into the body. For example, this article right here actually comes from PubMed, and it's an article that was done about a year ago. And the article, the title of it is Inflammatory Reactions to Red Tattoo Inks. So what they found is they looked at an emerging problem in people getting these tattoos. And hey, I'm the first one to say, I actually think tattoos look really cool. But again, when you put ink and bypass the barriers, that's considered a foreign body that innate immune system has to deal with. So here was their conclusion. Inflammatory reactions to red tattoo inks are an emerging health problem. Because remember, anytime that goes past the barrier, the immune system has to take care of it. Then when you look at joint replacement surgery and the innate immune system, again from PubMed about 5 years ago, here's what they found. This is what their conclusions were. They said, although joint replacement surgery is highly efficacious, and I'm the first one to say people who've gotten a joint replacement surgery that said it was amazing, it was wonderful. However, here's what they say. They say complications such as microbial infection, aseptic loosening and osteolysis, and metal-induced adverse periprosthetic inflammation, meaning that the metal that is part of the joint replacement can actually cause inflammation, have been reported as examples of adverse local tissue responses. So they say there's an increasing concern regarding the role of the innate immune system, what we just talked about, and more recently with metal byproducts, and now the adaptive immune system, which means that these metals are getting broken down, they're getting gobbled up by the immune system, and now the immune system is with those cells that are infected with the metals, now the actual adaptive immune system, which is natural killer cells and things like that, once those cells get infected, those natural killer cells go in, or those CD4, CD8 cells, they go in, and they start destroying the cells that are infected with metals. And that is called autoimmunity. So they say that in the pathogenesis of post-surgical adverse events that compromise joint replacement surgery, in this respect, we need further research. Yet how many people do you know are getting joint replacements? How many people do you know that are getting implants into their teeth? That are getting all of this metal implanted by bypassing those barriers that forces the immune system to say, you don't belong here. I need to do something about this foreign body. And it is a constant, chronic, unrelenting, constant inflammatory reaction that's taking place inside of the body. But if that surprises you, I want to show you this one, because this one right here, I think we're going to see a lot more of this. And this is an article from actually October of 2019. And the title of it is Breast Implant Surfaces and Their Impact on Current Practices, Where We Are Now and Where We Are Going. So they talked about current breast implant practices. And they asked the question is, it doesn't matter if it's saline, it doesn't matter if it is whatever it is on the inside. So silicone or saline, doesn't matter what it is. The problem is not what's on the inside. The problem is what's on the outside. So what's holding all of that in? And one of the things they actually found was they found that as soon as that implant was put inside the body, is that the immune system would immediately start to attack the surface of the breast implant and try to either digest it or wall it off to protect it from the rest of the body. So here's what they found. This is what their conclusions were. And this is going to absolutely blow you out of the water. And if you know, because a lot of women aren't have no idea about any kind of breast implant illness and how the symptoms of it actually are identical to any kind of autoimmune disease. So here's what they found. Many complication and adverse sequela of implants, such as infection, CC stands for capsular contraction, or breast implant induced lymphatic cancer. So that's what the BIALCL is a lymphatic or lymphoma type cancer that is spurred on by breast implants. So it's a very real phenomenon. So they say it may in part be related to the biocompatibility of implant surfaces. And I say, no duh, because anything that is not original tissue inside the body will never, no matter how much you make it, will never be biocompatible. That the immune system is always smarter, and the immune system is always going to say, you don't belong here, we got to get rid of you. So what happens is anytime that you're putting something foreign inside of the body, there's going to be a consequence. And one of the reasons why I'm so passionate about this is about 5 or 6 years ago, I had to get a lot of dental work. So I had a lot of old dental work, a lot of metal fillings. I didn't want the metal in my mouth. I had a bunch of old root canals, and I wanted to get those removed just because of chronic inflammation and infection that can happen within the gums that can then go to other parts of the body. So I actually had the root canals removed. So I had the whole entire tooth completely removed. And I remember the oral surgeon said, well, you're going to need to get an implant. And I said, I don't want an implant. I don't want any metal inside of my body. Because yeah, it might be okay if I get one or if I get two, but the more that I have inside of my body, the more problems it's going to have and the more burden I'm going to have on the immune system. So one of the things I said is I want the least amount of foreign bodies inside of my body. So instead of getting an implant, I actually got a bridge. So I got a bridge instead, just to keep a lot of the pressure off of my immune system. So here's the thing. When you look at breast implant illness is now what they call it. And I want you to look at some of the symptoms of breast implant illness, because again, this is a foreign body that the immune system has to take care of. So here's the symptoms. And I'm going to bring it up so that you can see it a little bit better. So fatigue, cognitive dysfunction, brain fog or memory loss, muscle aches, joint pain, hair loss, dryness throughout the body, recurring infections, gastrointestinal and digestive issues, rashes, food and chemical sensitivities, anxiety, and problems with the thyroid and adrenals. Guys, when you look at this and you consider those symptoms, those are all of the symptoms of autoimmunity. And guys, when we see so many women right now who are having these symptoms that are going on, and you would be absolutely blown away by really the number of women that are having autoimmune type reactions and have no idea that that's what's going on. And when they're having all of those different issues like fatigue or cognitive dysfunction or muscle aches or joint pain, they're going to their doctors, and the doctors are actually just giving them a drug for each one of those symptoms, yet they're not looking at the big picture and looking back and saying, I wonder what's happening with this immune system and what are the triggers to this immune system. And this is why anyone with any kind of autoimmunity, whether it's with thyroid, this is why we're checking the adrenals. This is why we're checking food sensitivities. This is why we're checking the digestive system. This is why we're checking all of those different areas in order to see what's happening inside of the body. See, one of the things that we have to do is we have to step back and stop looking at each individual symptom and look at the big picture. And so one of the biggest things that we can do is to step back and say, what's happening to the immune system And what can we do in order to take the burden off of the immune system so that the adrenals can recover, so that the immune system can recover, so that we can lower inflammation and go back to the normal state of health, which is balance and which is homeostasis. Those are symptoms of breast implant illness. But if you have an autoimmune reaction, how many of you know you already have those symptoms that are going on? So if all of those symptoms of autoimmunity are the same, maybe we need to start looking at things differently. Maybe we need to start looking at how to lower inflammation inside of the body, remove what's causing these inflammatory reactions, rather than just give people a bunch of steroids and try to knock out the immune system so that later on, even though it lowers inflammation with drugs, but it's going to leave you with cancer later on down the road. And in fact, if you don't believe me, all you have to do is look at the side effects of taking long-term drugs for any kind of autoimmune type condition. So this begs the question, what do you do? So what do you do for it? So, hey, Jeanette, thank you for responding. I had a root canal a few years ago, and I've always wondered about it. So I know that a lot of people probably get a lot of people asking, hey, what on earth do you do? Number one, where you do is you go to a biological dentist. So someone who knows about holistic dentistry, have them take a look at the root canals that you have. And I would actually say that these root canals can fester infections. And the best thing that you can do is probably just pull the whole entire tooth, take the whole entire root out. And then you can either leave the hole there if you're okay with it, but then don't use an implant. You actually will use a bridge. So a bridge won't screw anything into the bone or into the actual gum tissue. So thanks for your comment. So, hey, what on earth do you do? Number one, stop putting foreign bodies inside of you. All right. So the first thing is stop putting foreign bodies inside of you. So what that means is this is, yeah, if you need to have some kind of dental work, for example, make sure that you're getting a bridge or, false teeth instead of doing all of these different implants. Okay. But other foreign bodies, what about your joints? So here's the other thing. So many people are falling in love with, well, I'll just get my knee replaced or my shoulder replaced. But here's the thing. Keep the one that God gave you. So rather than run off and get all of your joints replaced, how about we do this? How about we keep the joints in proper alignment? This is where chiropractic comes in. How about you maintain great joint flexibility? This is where proper exercise comes in. And how about you have a very non-inflammatory diet that is not causing insulin and blood sugar to spike all the time? Because the people that are getting the most joint replacements are the ones who have chronic blood sugar and insulin issues. So how about we start working on causes versus running off and getting another joint replacement? So number one, you want to stop putting any kind of foreign body inside of you. This also includes breast implants. But number two, you want to keep the immune system as strong as possible. So anytime that we're dealing with any kind of autoimmunity, this also is going to include like foreign bodies. This also include getting food allergy testing in order to assess why your body's not breaking down your foods and why proteins, fats, and carbohydrates are actually leaking through the intestines into the bloodstream, where the immune system has to mount an inflammatory response to it. And then number two, you got to keep the immune system as strong as possible. So that big graph on the immune system that I talked about, yes, there are some things that you can do to keep the immune system as strong as possible. So you have to take the pressure off of the immune system. And then number two, build the immune system back up so that it can mount an appropriate response the way you were designed to do. So, hey, that's my take on autoimmunity. Stop putting foreign things inside of your body and then work on keeping your immune system as strong as possible. We'll talk a lot more about our immune system at our Healthy Kids event, Facebook Live within our Exemplify Healthy Families Facebook group. So if you are a part of that, I'll see you on Saturday at 9 o'clock for that live event. And if you're not part of our Exemplify Healthy Families group, ask to join it, search for it, ask to join, we'll let you in. And that will be a live video on the immune system. But I'm going to talk to you about how you develop your child's immune system and why things like fever, an infection isn't necessarily a bad thing. So, hey guys, I hope you have an incredible Tuesday night. Be well, and make sure that you like this. Make sure that you share this, especially if you know someone who has autoimmunity. Help them to think differently, because when you do that, you give them hope, and let them know all is not lost. You have a chance to heal, and you can recover. So, hey guys, have an awesome night, and we will talk to you soon.